Hello and welcome to Joy Wellness Partners. I'm here with our partners, Nexus Physical Therapy, who are going to help us out today to demonstrate some of the post-procedure instructions and rehab exercises that are going to optimize your post-treatment plan and recovery. We really aim to help your treatment to be the most effective treatment possible, and the best way to do that is to have quality rehab and programs to follow to strengthen your muscles and to improve your stability and to help your body to get into the state of healing every single day. Let those growth factors and those regenerative solutions that we've put into you get to work and to mobilize them in the most effective way possible and prevent future injury. Thank you so much for being with us, and let's get started.
Hey, hi guys, welcome. So this is the Team Nexus here. My name is Aaron. This is Emily and Carlos. We're going to demonstrate some exercises to help build some strength, give you some decompression, and get that injection to make sure it's doing its job. We want to make sure that we're giving it enough space to actually heal and recover in there, and then we're going to follow that up with extra strengthening so that it actually stays in there and your muscles are supporting that joint that you've had the procedure done to. And so we're going to give you a handful of exercises that we want you to keep working on at home throughout the first 2 weeks to get started on this. From there, you can start progressing into higher stuff, but we're going to start off with just some fundamental foundation training, and let's get to work. So exercise number 1 here, we're going to work on some breath work. So it is very important that we want to deload the spine, and the best way to do that is to make sure that you're breathing appropriately. So a lot of us get stressed and tensed up at work or just in life in general, and we forget to use our diaphragm. The diaphragm is one of the most important muscles in the body, and with that, it's going to give your upper body and your shoulders a chance to relax and let yourself be the most optimal that you can be. So a great way to start training that is just laying on your back. We're going to elevate the rib cage, bring it up nice and high, let your head stretch out tall like a piece of papers or a rope is pulling you from the head, extending your spine. And from there, you should feel a little bit of stretch in your low back, but you shouldn't feel any pain with this. If you're feeling pain, you're going a little too hard. Next, let's bring both of the knees together and go ahead and give a gentle squeeze on the inner thigh on the adductors. And now we're just going to work on breathing. So when you're diaphragmatic breathing, you want to breathe in through the stomach and out through the stomach. It's very important that your chest isn't rising and you're letting your diaphragm do the work. A good way to test that is putting one hand on your belly, one hand on your chest, and you should see which one rises. When you take a breath in, your stomach hand should rise. When you take a breath out, that stomach hand should decompress there. Okay, so we're going to go through and we're going to do 2 minutes of this. What I want you to do is 3-second inhales, 3-second holds, 3-second exhales, and a 3-second hold. You can start with that pattern. You can build up to higher, longer patterns with that, but we want to get you into a pattern of breathing and make sure that you're consistently doing that while you're working on this exercise. Okay, so as you can see, her stomach hand is rising, her chest hand is not. And while we're doing this, we want to keep the rib cage elevated, making sure that you're not collapsing in your spine. We're actually lengthening and giving your spine space in there so it's not taking all the gravity pressure and you're able to give it some offload pressure. Okay, after you've done a couple minutes of this, we want you to go into some transverse abdominis training. For those of you who don't know what that means, it is a strap-like muscle. It goes around your stomach and wraps to your low back. That is your natural back support. So how we're going to strengthen that is you're going to pull your belly button in towards your spine, and you're going to hold that position. Just like a drawstring is hooked to your belly button directly through your spine, and you're pulling that straight back. This is also called a vacuum pose. You're going to hold that position for 5 seconds and relax for 5 seconds. Draw in and hold, keeping that rib cage elevated, making sure that you're staying long, keeping the knees squeezed together. That's going to lock your pelvis in. And we'll perform this for repetitions. Let's start off with 10 repetitions with that 5-second hold. Take a break, and we'll do that for 2 sets. Let's go into feet across the pad here. Okay, we're going to put pressure onto our big toes and let our heels come out just a little bit so your foot is just a little bit more internally rotated there. From there, we're going to bring the chest up high again, keeping that stomach drawn in and nice and tight, making sure we're offloading the spine, keeping yourself in good posture. And from there, we're going to want a hip hinge. So you're going to push your hips straight back. Good. And as you see, she's keeping a nice flat back here. You don't want the back to round out. You want to keep that in a nice neutral position. You should feel this on the back, on your hamstrings, on your glutes. You shouldn't feel a lot of pressure on your low back. If you are, you want to make sure that you're squeezing your glutes and hamstrings a little harder and making sure that you're keeping the rib cage elevated and your core engaged. Let's hold that for 10 seconds and then squeeze the hamstrings and the glutes. Stand back up nice and tall from there. And that is one repetition. Let's take a 5 to 10 second break and we'll go back for repetition number 2. Okay, core engaged, your rib cage tall, pushing back until you feel tension into the hamstrings, and you only need to go as far back as you feel comfortable. Don't push yourself into a position that's painful or making it more aggravated. So starting off with this move, you want to be able to hinge efficiently at your hips. Why is this important? It's important for when you're getting into squatting, lunging, going up and down stairs, sitting down, standing up. This is an essential movement that has to happen. If you're not hip hinging correctly, you're going to put a lot of stress on your low back and overload the pressure back there. So a good way of learning, as you've seen, she had her hands here with the bend. That's a great way of knowing where your hips are at. And if you're starting to round out, you're going too far. You want the spine in a neutral position. If you want to find neutral, you just tilt your hips forward, tilt your hips back, and we're going to sit right in the center of that. That's your neutral position. Okay, so an advancement off of this, if this is getting too easy for you, we're going to do essentially the same movement. So hands are on the hip, chest is nice and tall, stomach is engaged. Let's push the hips back till you feel a stretch and tension into your hamstrings and glutes. Tighten those hamstrings and glutes. And now we're going to bring the hands together and reach straight up overhead. Okay, when you get to this overhead position, you can hold this. Make sure that your low back is not feeling tension. You're feeling a stretch through your lats here. To engage that even more, you're going to reach your hands forward. Good. And well, let's hold this position. So now we're elongating the lats, we're getting engagement in the core, the glutes, and we're decompressing that spine back here. Same thing, you should feel no pain with this. If you are, we want to regress back to just a basic hip hinge position. Same position, we'll hold this 5 to 10 seconds. Let's go ahead and let the hands back down. And let's hinge at the hips, come back up. Very good. For this stretch, we can hold a little bit longer. We're going to go for 30 seconds, and then we'll switch sides. Still working your diaphragmatic breathing in this position as well, and making sure that you're not getting pain in your low back or in the front of the hip. If you're feeling pinching in the front of the hip, let the leg come down just a little bit. Don't go quite that far. And if you're feeling pain in the back, same thing. Let the knee that's into the chest come down just a little bit and don't pull so hard. This is a gentle passive stretch. All right, let's go ahead and slowly lower down and switch sides. So when you're pulling here, if you are experiencing back pain, you can also bend this left knee or the leg that's on the ground, and that will give your back less pressure onto it and allow your hamstring and your glute on the knee into the chest side to open up even more and give you that space and distraction in there. We're going to go into a half kneeling position. If you're having pain on your knees, make sure that you're on something soft and cushiony. You can even take a pillow or a couch cushion from home to put your knee on. And if that's still too much, don't worry about this one. So in this position, half kneeling, we're going to keep the hips in a neutral position. We want to make sure that your low back is not arching too much here. As you're stretching the front, that wants to pull your spine into that arched position on the low back. So you're going to keep your hips tilted underneath you, just to a neutral position, not all the ways that you can. And then we're going to give a gentle pressure forward until you feel a stretch on the down leg, right in the front, in the hip flexor, in the quad, maybe even a little higher up into the higher hip flexor here. So we'll hold that position. Let's go for 10 seconds. After the 10 seconds, let's bring this hand that's on the hip, on the leg that's downside, up and over your head. And we're just going to hold here and reach high with that hand. Now we're giving distraction to the arm. We're opening up that lat, and we're opening up the back on one side here. We're going to do this on both sides, so don't worry about being unbalanced. You can also focus on squeezing your glutes in this position to make sure that your low back stays locked in and engaged. And we'll hold this position for 10 seconds as well. Let's come back down and let's switch sides. Perfect. Chest up tall, big rib cage. Let's keep the hips tucked underneath. Squeeze the glutes and lean forward until you feel a stretch on that down leg. Good. Reach that hand nice and high. And then as you get more advanced, you can even reach more to the side. Very nice. Now this is opening up not only the front side, but it's also opening up your QL on your back side, which is the stabilizer of the low back, one of the most commonly tight muscles that we see in low back patients. This is a great way to open it up. And go ahead and relax there. Very nice. So now we're going to go into even more core stabilization, just a vital piece that you need to have in your rehab programming. Especially starting off, you want to make sure that you're giving your neutral position and your center of gravity support and stability in there. So this is a nice exercise that we like to use. We've already went over how to activate your transverse abdominis. That's the strap-like muscle that keeps your back safe. Now we're going to strengthen the rest of the muscles, including that one in this area. So this is called the 8-point plank because we have 8 points of contact. 2 hands, 2 elbows, the knees, and the toes. As you see, she has her toes flexed underneath her, so she has pressure there. So the first thing that we're going to want to do is make sure that the elbows are in front of the shoulder. You don't want them to be directly underneath. And from there, we're going to lift the head up. Good. Lift the rib cage up and expand and stretch that rib cage out. And then ever so slightly lift the hips up just a little bit more. Right there. And now you're focusing on squeezing your core. As you can see, she's already feeling it. And we're going to want to pull the elbows and the knees together in this position. So this is just a modified version of a plank, but very effective, very minimal on stress onto the joints. We're going to hold that for another 5, 4, 3, 2, and relax. Hips down. Good. Mid back down, head down. So head comes up first, followed by the chest and the rib cage, expanding and giving yourself as much stretch and space in there as you can. And now let's bring the hips up off of the ground. You should have that core engaged. As you can see, her back is in a nice flat neutral position. She's not arched or rounded out here. And you can also squeeze your glutes in this position. So when your core is engaged and your glutes are engaged, your back is in a pretty safe position here. That is giving it maximal stability. And this is the baseline that you want to start everything off of as you continue to progress into more advanced sports, whether it's running, any athletics, weightlifting. These are essential habits that you need to have narrowed down. Go ahead and let the hips down and the chest down. And you can start with this as little as 5 seconds at a time, and you can build up to a minute. Once you're at a minute, we can advance to further things from there. So next we're going to move on to an exercise called bird dogs. So we're in a quadruped position, so hands are on the ground, knees are on the ground, directly under the shoulder and directly under the hips here. So as we've been working on the abdominals, getting engaged, the 8-point plank, the transverse abdominis, and the diaphragmatic breathing, now we can progress into something that's a little bit more functional. This is a little bit harder, but we're working on stability and coordination. So we're going to start in this position here. The back should be neutral, not arched or not flexed, just right in the middle. And we're going to raise one arm out. Hold that position, contract the stomach, and pull the belly in towards the spine. And now we're going to bring the opposite leg out. Good. And we're going to hold that position. So very important factor to look for is the back. You want this to be neutral. A good cue is you can set a stick onto your back, and if it falls off, you're going too crazy. We want to keep this slow, smooth, and controlled. We're going to hold 5 seconds in the outreach position. And as you're outreach, you're reaching your hand towards the wall and your foot directly towards the wall, making sure that you're not going up but out. Okay, let's go ahead and bring those back in. Reset yourself in the center, re-engage your core. And let's reach out with the left hand and the right foot. Good. The head's going to stay in a neutral position, looking straight down towards the ground. And back in. Very nice. Let's do a couple more. We can perform this for repetitions with holds. Let's start off with 5 repetitions on each side for a 5-second hold. And it is very essential that you go slow with this. This is a very easy one to go too fast and get out of form. And the first place you're going to notice it is the low back here. When you're seeing the arch and feeling a pinch in the low back, that means you're going too much. So as we were talking about earlier with the core and the backside being engaged at the same time, you want to have that equal and opposite balance there. Very nice. Back in. This exercise is called a dead bug. So it is basically just like the bird dogs, but now you're laying on your back. So you're going to bring your arms and your knees up to a 90-90 position. Good. Now from here, chest is going to be tall, core is going to be gauged, and we're going to slowly lower one arm and one leg on the opposite side. Good. Keeping the limbs that are in the start position, making sure they're staying at 90-90. Let's go ahead and switch. Good. Slow, controlled movement. This is a very important one to feel that your back is not reaching up off of the mat. If your back is reaching up off of the mat, you need to go for a shortened range. If you're able to go all the way straight with your back with no pain, hip with no pain, shoulder with no pain, then we can continue to work on these. If you're feeling any pain or discomfort with that, we're going to shorten that range. If it's still uncomfortable, we can just do one limited time to where we're just doing either just the hips or just the shoulders. For this exercise, we're going to hold for a 5-second count and go for 5 repetitions on each side. As you get comfortable with that, we can build up. The max in a set that we want to do is 10 repetitions. From there, we can progress and make that harder with different exercises. Continuing to pull the stomach in, keep the core braced, making sure that you're still breathing with that diaphragmatic pattern, your chest is not rising. Now we're working down lower in the body, so if you have ankle or knee issues, this is a great exercise to work on. Also, if you have swelling in the lower extremities, this is a great way to push some of that swelling back into your system and help your joints just be healthy and not have that extra pressure on it, so the work that you've had done here can actually do its job. So we're just going to do a ankle pump here. So you're going to squeeze your knees together. You can put a towel, a pillow, anything you have in between there, a ball, and your feet are going to stay in a straight up and down position. We're just going to push the ankles down and up. Very nice. It is ideal to do this on a bed or a couch where your feet can lay off the edge. Also, if you're dealing with swelling, you can also elevate with extra pillows underneath your leg or on a recliner where you're laying back, where your feet are higher than your heart level. That'll help that inflammation reabsorb back into the body. So this one we can go for 20 repetitions. Main points are you're wanting to make sure you're still squeezing this together, keeping your knees straight up. Your kneecaps should be facing the ceiling and your toes should be facing the ceiling. Along with that, you want your rib cage elevated and lengthening through the spine just to keep a good tall position. For this exercise here, we're going to be in all fours. We're going to work on mobilizing the hamstrings and the calves and getting that blood flowing in there, getting new nutrients into the area, reoxygenating that, and opening up that whole posterior chain. To do this one, you want to have mastered the hip hinge and make sure that you're able to move at your hips without your low back flexing too much. So we'll start here in the hands and knees position, and we're just going to elevate the hips straight up towards the ceiling. Good. Now, arms are locked out, you're keeping pressure there, and you're still thinking about lengthening. You don't want to be compacted, you want to be long and tall. So from this position, you can keep the knees bent just a little bit. Good, just to offload the spine. And from here, we're going to floss back and forth. So we're going to bend one and straighten one in a slow, smooth, controlled position here. Let's go back and forth, making sure that you're keeping good, slow, controlled breaths. Good. You should feel no pain in the back of your knees or in your Achilles. If you are, you don't want to push that far or that hard. And if you're feeling pain into the back, we might want to regress you back into a hip hinge motion to make sure that you're understanding that position before you start getting into something that's a little more dynamic. Let's perform this for 10 repetitions on each side. When you finish your 10 repetition, your knees are going to go back to the mat. For rest times, we can always go anywhere from 30 seconds to 90 seconds. You want to give yourself time to recover and make sure that you're not overexerting yourself. These are decompressive, simple things that we want you to get control with, and you shouldn't be exerting yourself at maximal effort. You should be sitting at 60% effort or so in these positions. Okay, so now we're going to work on the lower extremity, on the calves and the ankles a little bit. So this is called the runner stretch, which I'm sure a lot of you can relate to. Whether you're running or not, we're walking all day, we're on our feet, we're doing active things, and the calves take a lot of your load. So we want to be able to give them a little bit of a break and unload these calves and your knees and your ankles, along with the low back, your sciatic nerve and the whole nerve bundles that run through there go all the ways down to the lower extremity, and we'll get stuck down there sometimes. So the runner's stretch, you're going to go hands onto the counter, feet are in a staggered position, and your back leg's going to be straight, heel on the ground, making sure that the foot is straight, like that right there. And now you're going to lunge into that front foot until you feel a stretch on the back of your calf. We're working on stretching your gastroc muscle here. This one crosses the knee joint and is very important for knee health along with ankle health. We'll hold this stretch for 30 seconds and then we'll switch sides. Key points is keeping that back foot straight, The heel should stay onto the ground. Your hips should be aligned. You shouldn't be rotating your hips one way or another. This should be directly facing the counter. And you don't want to put too much pressure onto either leg. You want to keep that equally distributed and make sure that you're feeling a good, comfortable stretch with this. This should be pain-free and you should feel that muscle elongating. Okay, let's go ahead and switch legs. And we're going to work on a soleus stretch. So the two main muscles that you have in your calf, we just hit the gastroc, now we're going to hit the soleus. So same setup, only difference is your back knee is going to bend, and now you're going to flex forward, but also keeping a little weight on the back leg, so you're feeling more of this midsection of the calf stretch, not so much the top, but more in the center. Good. The knee should be tracking right in line with the toe, and your heel should stay down on the ground. We'll hold this for 30 seconds and switch sides. Good. Foot straight, heel on the ground, back knee bends, gentle forward pressure, and make sure you don't push so far forward that you're not feeling the stretch on the back. You still want to keep a little bit of weight on that back leg. Okay, so we're going to use a very commonly used exercise in PT here. This is called a pendulum. So what we're letting this arm that's dangling do is we're trying to let gravity give that space inside that joint and open up the joint space. Very important. The shoulders get so tight and bound up in there. Just with all day, everyday life. So we want to let that just hang and relax. In the start of that position, you can just let it sit there and relax. As you get comfortable with that, you're going to want to start moving your arm around in a little circle, but you don't want to use your arm to do that. You want to use your body and move your body so your arm is at a dead hang, and we're just getting some gentle relaxation in the shoulder. If this is too easy, you can hold on to like a water bottle or something that's light, a 2-pound weight, 3-pound weight, something that gives you a little extra stress, but the main point is keeping that arm relaxed and just letting your body weight give it small circles. This rhythmic rotation will help open up all the stabilization muscles on there. And at this point, we're wanting to relax everything. We don't want to put over pressure or over stress strength on it, so we want to make sure that you're getting good, comfortable relaxation. Good, let's go 20 times to the left and switch 20 times to the right. Okay, so this is a posture fixer exercise. Now we're gonna go into getting the chest elevated, hands are down by your side, palms facing forward. We're gonna give a small squeeze back, not so far that your arms are bending back, just enough that where your scapulas are engaging and you're feeling a small pinch in your muscles right between your shoulder blades. Chest should be out nice and tall, ribs should be elevated. From here, we're gonna work on pulling the core in, holding that belly button to the spine position, and you're going to hold that throughout the whole motion. And now we're also going to bring the chin back just a little bit to a neutral position. If you have a side view, you want equal through your ear, your shoulder, your hip, and your knee. Everything should be stacked straight in a line here. This is going to help us fight gravity and make sure that we're in good positions. This is a nice one to use throughout your day when you're just standing, sitting at a desk. Sit back, get yourself into a good position. Get that mental cue and try to hold that position as you go throughout your daily activities. Good. Go ahead and relax. We'll hold these for 10-second holds, little breaks in between. And same thing, chest tall, shoulders back, stomach is pulled in, and the chin is pulled back. Right there. Very nice. So now we're going to work on more shoulder decompression. We're going to try and open up the lat, and this will also help open up your low back a little bit. So we'll go hands on the counter, feet shoulder width apart. We're going to push our hips back into a good hip hinge position, and our hands are going to stay planted on the counter. So from here, we're opening up that lat. This is such an important muscle. Let that stretch, relax. You shouldn't feel any pinching on the top of the shoulders, in the back, or the low back. You want to breathe, open up your chest, let your chest and rib cage expand as much as you can, and just relax into this position. If you're feeling pain in your low back, you can also bend your knees so it takes a little tension off your hamstrings. Very good. Let's hold this stretch for a 30-second count and come back up. You can do this with both arms on the counter, one arm on the counter. You can also use a doorway where you're just grabbing on and holding and gently sitting back. The most important thing is don't go too hard with this. This is a gentle stretch where you're wanting to open up here. All right, let's bring that back in one more time. Good, hips sit back, shoulders are straight, elbows are straight. Big breaths in, making sure that the ribs are expanding, chest is tall, we're not collapsing. And you should feel that stretch running from the back of your shoulder all the ways down to the mid-low back. Very nice. If you want to add an extra kick to this, you can bring 2 hands to one side, cross over, yes, and sit back. Now this is working one side where we're opening up just the single side, and then you can even play around with body rotation where you're rotating your body up a little bit or down just a little bit to wherever feels comfortable for you. Again, very slight, very gentle. There should be no pain or discomfort, just a gentle stretch feeling with this. We're wanting to hold these stretches for 30 seconds, and we can do all 3 positions. Hands straight forward, hands to both sides once you feel comfortable. Now we're going to start working on some lower extremity stabilization. So we've worked on stabilizing your core, making sure that your body is lengthened, that your posture is in a good position, and you should be emphasizing these on a daily routine and making sure that you're putting these into effect. It is such a massive factor to have these in your routine versus not having it. The benefits are going to outweigh the work for sure. So now let's get into a little bit of leg strengthening. So we're going to come to a wall. Anywhere that's a flat surface, you can work on this. Back and shoulders are going to be on the wall. Feet are going to be 6 to 8 inches out from the wall. And we're just going to slide gently down. Let's hold right there. Chest up tall, thinking tall, tall, tall. Chest is high, ribs are high, head is going straight up. And we're just going to hold that position. From here, you're thinking about having 3 points of contact onto the ground. You want your big toe, your pinky toe, and the center of the heel to be creating a tripod onto the ground. That's going to give you equal stabilization with your quads, hamstrings, and glutes. And it'll also keep your knee tracking in a good line. You always want your kneecap to be over top of your foot. You don't want it to be to the outside or the inside, okay? Good. Core is pulling in nice and tight. Let's start off with 15-second hold and slide back up. Good. Little break. Let's go down again. With these, you want to start with small holds, making sure that you're able to get a good feeling in your muscles without having extra loaded pain. And as you get comfortable, you can progress up to a minute with these. From there, we should be able to progress into more intense exercise. If you're having any pain, you don't want to go quite so low. You can go a little bit higher. There's no limit of how high, but you do want to stay higher than a 90 degrees. Once you're at the 90 degrees, we don't want you necessarily going lower than that. We want you to stay above 90 degrees. Once you're feeling good with your wall sits, we can progress to something that's a little more functional, a little dynamic. Now, this is something we have to do all the time. A lot of people think of squatting as an intense form of exercise, which it can be, but you also have to look at it as the most downgraded version, which is just getting up and down off of your couch and off of your chair. And we want to do this the right way so you're not hurting yourself. So we're going to start in a standing position. Your chest is going to be up tall. Your stomach is going to be engaged. As we've learned, you're going to hip hinge your hips back. And from there, we're going to sit down. So let's go ahead and push the hips back. Slowly bend the knees. Come down, touch the chair. Chest can come to an upright position and then right back up. We want to go slow and controlled with this. Hips push back. Chest stays up nice and tall. Knees stay tracking over your toes. And standing right back up. Good. Now when you're doing this, you're also thinking about your feet. You want to make sure you have equal pressure on the front of your foot and the back of your foot, along with the inside and the outside. You want to have that tripod position where your big toe, your pinky toe, and your center of your heel are all pushing it with the same amount of pressure. That's going to keep your feet and knees aligned and help you create power and force that's going to help you get up and down in the right way without your knees buckling in or your back rounding out. Good. For this, the goal is to be able to get up to 10 repetitions with slow, smooth form. It should be a 3 seconds on the way down, 3 seconds on the way up. Make sure that you're not plopping down into the chair and hurting your low back. And this is the basic version of an advanced squat. So this is really the most fundamental piece that you have to have down. You have to understand how to keep your core engaged, bend your hips, and sit down properly before we can start looking at getting into a good squat, a good lunge, and even running. So the next exercise we're going to work on, we're going to get a rubber band. So if you have a loop band, we're going to tie it onto something. If you have a sturdy chair, a doorway, a bed frame, a squat rack, whatever you have, this is a great way to start emphasizing these. So take a band, tie it around your object. If you have one that's already looped, you might be able to pick something up and put it underneath, just nice and gentle, tie together. Okay, so this exercise is called a terminal knee extension, or TKE for short. So you're going to put your foot through the band. We're going to have it just right below the knee, and then we're going to go into a staggered stance. So the foot that's in the band will be in the front, the other one will be in the back. And now we're just going to let a gentle 5 to 10 degree bend on that knee. Let it stretch just a little bit and then squeeze your quad and your hamstring and come back. Nice and slow and smooth. This is a very important exercise because every time your knee bends, you have a rotation that happens inside there. So this small motion is very vital. If you have any type of hyperextension or just knee pain in general, this can help unlock your knee and put you back into a good position for walking, running, jumping. Good. We can perform this for 10 repetitions. Take a little break and we'll switch sides. Very nice. Main points to keep involved is the knee should always be tracking over top of the foot. You shouldn't let it be falling to the inside or the outside, and you're keeping that equal pressure onto your feet, along with your hips staying squared up towards the object that you're working with. And then when you're pushing back, you want to make sure that you don't overextend your knee. You're just going to a comfortable position. You don't need to flex as hard as you can. We're wanting to flex at a 50 to 60% effort right here. Thinking about flexing the front of your leg on the quad muscle. Very nice. And switch sides and repeat. For our next exercise, we're going to work on strengthening the lateral side of your hips, your core, and just getting you into an athletic position. So what we're going to do is take a band. If you have an open-faced one, we're going to tie it together. The tighter you make it, the harder it's going to be, and the looser you make it, the easier it's going to be. If you already have a loop band, you're ahead of the game. Okay, so we're going to tie in a nice knot. Let's go ahead and put this around your knees. Step both feet through. You can also put that on sitting down just to keep yourself safe. Okay, so the band's going to be right around the knees. As we were working on our hip hinging earlier, hands are going to be on the hips. We're going to bring those back into a small hip hinge where you feel your hamstrings and glutes engage. Chest is going to be up nice and tall, and your core is going to be engaged. From here, you want your feet in a neutral position, and we're just going to step one foot out to the side and the other foot. Good. Small, controlled steps. Most important portion of this is this band is going to be pulling your knees together, so you're wanting to drive your knees out to engage that lateral glute muscle and give yourself stability in all planes. Very nice. And you can work this in your hallway, anywhere that you have space to get about 5 to 10 steps to each side. Going slow and smooth. The small steps are the secret, and pushing those knees out into the band so you're feeling on the side of your hips. To progress this and make it harder, you can go just a little bit lower. Hip hinge, hamstrings are engaged, glutes are engaged, chest is tall, stomach is engaged. Stepping to the side. And as you're moving through these movements, you want to recheck in and make sure all those things are still engaged as you're moving through. If you're feeling like you're losing control or you can't feel one of those muscles, we need to reset and fix whatever is going on there.
Thank you so much. You guys are such an awesome team.
Thank you, Carol.
We're totally pumped that we have all these exercises that we can practice at home. If anything felt overwhelming to you and you feel like you need the accountability to work on this with a coach, these experts are here and ready to help. What contact information can you provide for them?
Yeah, so you can follow us at nexuspt.com. That has all of our locations. So we have 7 locations here in San Diego, ranging all the ways from East County to North County to South County. So we're trying to hit as convenient as we can for everybody. And then that website will give you directions, phone numbers, addresses, everything you need. So it's nexuspt.com.
NexusPT.com. Thank you so much.
Thank you, Carol.
And I'm assuming you work with people of any age or any level of athleticism.
Yes,
beginners.
absolutely. We work with beginners to advanced. We even have specialized locations for people that are more advanced, where we have a full weight room, getting people into gym memberships, aquatic therapy, along with anybody that's just starting with moving too and wanting to get them into the foundations, because this is things that you want to build, and then once you have that foundation, that building, then we can start stacking on top and putting strength, functionality, stability, things that will stay long lasting and protect your joints and protect you and keep you living a long, healthy life, you know?
Yeah, keep you away from surgery, keep
you
healing and out and being active and living well. Thank you all so much.
Thank you, Carol.
We'll keep it up.
Yes.
Thanks for watching. I'm Carol Joy Bender, the founder and nurse practitioner at Joy Wellness Partners. If you found this video helpful, give us a thumbs up. Please subscribe also to our channel and share this video with someone who you think could benefit from it. You can also learn more information about these services by clicking our link in the description below. You can also leave a comment to let us know what content you'd like us to put out next week. Thank you so much for being a part of our community, and stay along with us for enhancing wellness in our world. See you next week.